Hey Bustmob, happy Tuesday, and thank you so much for joining our Bustmob collaboration live event. I will hopefully be joined very shortly by Dr. Rafi Fredman from Amelia Aesthetics in St. Louis. He generously donates quite a bit of his time in his busy life and busy practice to the Bustmob community, specifically in the Ask a Surgeon section of the group, where you all can ask him questions when maybe you haven't heard back from your surgeon yet, or you don't want to, maybe you don't have a surgeon yet. It's a great free resource for the women of Bustmob to be able to have many board certified plastic surgeons answering their questions. There he is. Thank you, sir. You are much more prompt than other surgeons usually to figuring out this Instagram live game. So welcome.
Thank you. Thanks for having me. It's nice seeing you.
I know, you too. I am sorry. I was supposed to be Jenny today, but Jenny is sick. But luckily, there's lots of Bustmob babes who can step in and ask you many, many questions.
Oh, great.
Because the community came up with a lot.
Awesome.
And I did send you some of them. So hopefully it won't be too much of a surprise.
Even if it is.
I know, it's kind of, I like rapid fire stuff.
Sure, yeah.
But housekeeping wise, women did send these in ahead of time. If you want to try and drop questions while we're talking, I will do my very best to try and listen and scan them, but I can't always guarantee I can get to them. But I kind of tried to lump these questions as well by topic, so we're not kind of all over the place. For whatever reason, there were a ton of lift type questions today. So I figured let's just talk about that to begin with. So if you're interested in breast lifts, we're going to talk about that first. Then there were a couple questions about kind of like pain management and recovery for different types of surgery, and then augmentations kind of at the end, like straightforward, no lift augmentations.
Right.
So we will get into that. But last time you were on, you had a little baby with you. Mm-hmm. So how is busy life going over there in St. Louis?
He's doing great. Little baby Bo. He's a great baby, and it's going great.
That's awesome. Yeah. Congratulations. That was a lot of fun. Thank you for not only taking the time to do things like this for women, but like I was saying before you even hopped on, all the time you donate to the Ask a Surgeon community. It's so helpful. And I'm sure it's a lot given all the things you do, but it's very reassuring. I hear it all the time that women are really happy to have somebody at their fingertips, at least be like, you're okay. Wait for your surgeon. So thanks for doing that.
No problem. I love getting to answer questions and being available. And it's great to get to talk to people on there.
Good. Well, thank you. All right, let's get right into it. So we're going to talk about questions you sent in about lifts. And again, I tried to make a numerical spread, organization situation for myself. We'll just see how it goes.
Great.
The first question was, how long does a breast lift with no breast augmentation, so no implants, just a lift, last? Which is just a loaded question in itself. How long does it last before sagging can occur again?
Yeah.
I think I have an idea of what I would tell someone, but that's a really common question. So
sure, yeah.
Does a breast lift last?
Right. Because, if you were going to be signing up for surgery, hey, you got to have another one of these every 5 years, 10 years. That's a lot. That's a big, commitment. So it's important to know before going into it. So the answer is that it depends on a lot of things because everybody is different. In general, with a lift, we hope that you don't need to have another lift ever. That'd be great if you don't need to have another lift. And many women have a lift and never have another lift. But so many things play a role in how things change over time. Genetics, a major factor in how tissue holds up over time. People's skin quality is very different. Life changes if people get pregnant or weight changes. A lot of these things can change the position of things and may lead somebody at some point to feel like they want another lift. But I always tell people, you are not signing up for a lift every 10 years. Those things can happen, but my hope is that we do this and that's the only lift that you need.
People used to ask for any surgery, like, how long is this going to last me? And my at least fast response was always just like, surgery will not stop the aging process.
Sure.
So whatever you're having, the process of aging, it's not going to stop that.
Right.
But yes, I agree. Most women do not have multiple lifts.
Yeah.
But yeah, if you've got that super stretchy skin, they might not in 10 or 15 years be where they were that first year, and you might want to consider it. So, but there's no time frame, like you said. Okay, does performing a lift mean you can go smaller with the implants? So do people ask that kind of question?
Yeah, so what I think that's asking is, does getting a lift mean you could maybe get a little bit of a smaller implant? So yes, in a way, because in a lift, you have to remove a little bit of breast tissue to do the lift. There's a little bit of breast tissue at the lower part of the breast that has to be removed in a lift to bring everything in around from the sides. So with a little bit of breast tissue removed, depending on the person's goals, it may be that a small implant is all that they need. And when it comes down to it, it all depends on what the person's goals are. Can you do a smaller implant with a lift? Yes, for sure. But it all just depends on what the goals are.
Got it. While we're talking about this, I get a lot of questions too about the kind of, I got a lot of breast tissue at the bottom of my breast. I don't want an implant. Can it be put up here? And like, I know that it can be ish. Is that called something specific? Is that something that's done in every lift?
Yeah, so the term for that is called an auto augmentation. Auto because it's your own tissue, and augmentation. And the idea is that little bit of breast tissue, some people it's more than others, in the lower part of the breast that you have to do something with during a lift. You can either remove it and go throw it away, or you can do something with it. Now, if you're getting an implant, that little bit of breast tissue gets removed and thrown away. You don't need it because you're getting an implant. That's going to give fullness. But if you're only getting a lift and not getting an implant, then you don't necessarily have to throw that tissue away. You can actually keep it attached to the person's own body and reposition it in the upper part of the chest where you want some fullness. And that can add just a little bit of fullness if you're only getting a lift. Now, the important thing that I tell people, it's not a replacement for an implant. It's not a lot of volume. It would be the equivalent of maybe like a 100 cc implant in most people maximum, so they don't even make implants that small. So it's not a lot of volume, and over time it does tend to decrease the amount of fullness up there. But if you have it, you might as well use it if you want to add a little bit of fullness up there.
Okay, that makes a lot of sense, because there was literally a question kind of about that. So someone's smarter than me and knows this term, because then I want to ask too, well, people are like, if you've got my own tissue anyway, why can't, because at Amelia in general, we don't usually offer fat grafting augmentations. So what's the difference in using your own tissue and using your own fat?
Yeah, so they're similar. In an auto augmentation, the tissue that's repositioned stays attached to your body. It's not being taken out and put back in. So it's your own tissue and it's just being repositioned, just moving some things around to give some fullness. Fat transfer is different. In fat transfer, you take out fat with liposuction, so it's fully removed from the body, and then you process it and purify it, and then you inject it back in. You can use that, and some plastic surgeons do use that to try to add some fullness in some areas. But that has its challenges and downsides too. It sounds kind of nice, but why not just inject 300 cc's worth of fat instead of an implant? Instead of a 300 cc implant, put in 300 cc's worth of fat. That sounds nice, but it doesn't necessarily work that way, because it turns out there's only so much fat that you can inject at a certain time for that fat to live. If you put too much in, it's just going to dissolve and get absorbed by your body and not last. So there really is only so much you can put in, and also is really not a replacement for an implant. People that do fat transfer to the breast, you often need multiple rounds of it to kind of layer it on over time. So now you're talking multiple surgeries, which isn't necessarily great if you could get that result with an implant. And also we found that over time it doesn't tend to hold up as well. It just maybe initially on the table or a few weeks after, it's like, wow, I didn't get implants and I have a lot of fullness. But once you're talking like a year, 5 years, a lot of it tends to go away.
And is it true that it can cause issues in the future too with mammograms? I'd always heard that.
So yeah, so that's a good question. So fat transfer to the breast is safe. It does not increase the chance of breast cancer. That's important. If you're injecting something into the breast, you want to make sure it's not increasing the chance of breast cancer. So it doesn't, so that's good. But one thing that it can do is the injected fat can form little calcifications on it. And those little calcifications can look like breast cancer, and it could be that the radiologist can't necessarily distinguish it. So it may increase the chance that somebody needs to have a biopsy in the future to prove that something is not breast cancer. And a biopsy is very stressful. So that's another downside that tends to stray people away from it.
Got it. Yeah, that sounds like a huge pain in the butt. So thank you for letting me derail there, because I get a lot of those questions. So the person who knew better than I did about this term asked, can you still get implants after an auto augmentation, which you just explained is a, using my own tissue to reposition it to give me more fullness at the top. So could I get an implant later?
For sure. Yeah. So if an auto augmentation, a lift was done, and down the road, I want more fullness, absolutely, you could then get an implant.
Awesome. That is comforting, I am sure. Continuing on the lift topic, why do some photos with lifts and implants, have a weird square or flat look at the bottom? And how can I avoid this outcome?
Yeah. So I've seen that too. And the reason that happens is that tends to happen when you see an anchor scar. An anchor scar is around the areola down, and then really from fully one side of the fold all the way to the other. That's like an anchor shape. And if a plastic surgeon removes a lot of skin at the bottom in that anchor pattern.
Here's my anchor.
Perfect. That's right. If a plastic surgeon removes a lot of skin in the lower part, leaving that long anchor scar, it does have a tendency to square off the bottom. And for that reason, I try to avoid that full anchor scar. Now, I explain to patients that a full anchor scar is different than what I call an upside down T. So I will, not uncommonly in people that have a lot of extra skin, still remove some of that extra skin at the bottom, and they will have a little bit of that upside down T incision. It's not an anchor scar. It's not all the way from one side to the other. And I've found in my practice that does not cause that squared off look. They still have a really nice round shape, and I think that just helps with the position of things. But if that's only when it's needed. If it's not needed, then I definitely stray towards a lollipop lift to avoid any issues with that.
And doesn't it also kind of have that funny look for a while anyway? Like lifts have a longer recovery process than augmentations do. And I do feel like it often can be, they're kind of pointy, they're not rounded at the bottom, even 6-7 months out, and women are panicking. And it's just, you had to kind of over tighten that, right, to get the height you wanted. So it just takes longer to relax.
For sure, yeah. It's one of the challenging things about plastic surgery. It's one of the things that makes plastic surgery truly an art, is that it's not about how things look on the table or day one. It's about doing things during surgery so that 6 months, 1 year, 5 years, 10 years, everything looks great, which means that oftentimes initially things don't look like you want them to. You look at things right afterwards and say like, oh, I hope this isn't how it stays. So you have to do things intentionally, knowing how things change. And with a lift, we know that over time, the lower part of the breast is going to stretch and relax. So you have to go the opposite direction. You have to over tighten things so that as everything relaxes, you get the perfect amount of roundness.
Oh, well said. Okay, well, that you kind of already answered this question then, but this was for you. It was generally, do you use lollipop or anchor incisions? And I think what you just said is lollipop is first choice, unless you wouldn't get a great outcome with that. Is that how you would say it?
Yeah, and the way I would generally frame it is it's going to be a lollipop scar, but I may also take a little skin out the bottom and give a little bit of an upside down T. That's something that we talk about initially at the consult, and then definitely right before surgery when I'm doing surgical markings, and actually show this is exactly where your scars are going to be. That's when you'll really see exactly where it's going to be. But during a consult, I do a really quick exam. And then I like to show people their Vectra if they're going to get a lift, so I can explain exactly why the scar is going to look the way it's going to look.
Do you feel the same way regardless of whether you're putting an implant in or not? Does that make any difference?
Not really. The only difference it may make is if for a larger implant, that may help take up a little bit of skin, and maybe I have to remove a little bit less, and then maybe I wouldn't do it exactly the same way. But for the most part, implant or no implant, the lift is essentially done the same way.
Got it. Okay. If a person has an anchor lift and over the muscle 285 cc implants, and they want to remove them, can they get an auto augmentation? Everyone knows this word, an auto augmentation during the explant. That was a lot of questions.
That's such a good question. Essentially, no, practically. You know, the auto augmentation, at least in my hands, has to be done at the time of a lift. It's being done because there's tissue in the lower part of the breast that you're removing or doing something with, repositioning, and then bringing everything in around from the side. So if just an implant was being removed, there really wouldn't be a way to then have breast tissue to reposition. Also, if somebody's already had a lift, the goal of a lift is really to remove a lot of the extra breast tissue in the lower part of the breast. So there might not be much there that you really could take advantage of. So that probably would not work.
Okay, thank you. I think that kind of covered all of my lift questions. If you have them, drop them below. And again, I saw one question that I'm keeping in here, but it was about implants. So I'm going to try to save that one, but feel free to drop them in there. There were a couple that were about kind of complications, recovery, pain management. So let's talk about that. And this could be any surgery, I'm assuming. And I'm going to start with the most general, vague one. This is difficult to answer, but how common are various complications and how can you prevent or avoid them? Like, huge question.
Huge question, but great question. So it touches on a few different things. Anytime surgery is done, there is a risk of complications. The only way to not have any risk of complications is to not do surgery. Just like any time you get in your car and drive to the office, there's a risk there. I mean, anything you choose to do in life often has some risk. With surgery, the goal is to keep those risks very low and try to do everything you can before surgery to make those risks as low as possible, and during surgery to make those risks as low as possible. So the first thing to look at is the person having surgery, and are there things that are going to put them at higher risk or lower risk? And that's something that we spend a lot of time doing because you want to do those things before surgery. So things like not having any nicotine in your system, or diabetes being well controlled, having a BMI under 35. Those things are really important to decrease all risks really across the board. There's a lot of things that are done during surgery to decrease risks. So in general, how common are complications? For the surgeries that we're doing and the patients that we're doing surgery on, complications are low. It's very different in surgeries that are being done at the hospital and people that have medical problems where complications can be a lot higher. So complications in general are low. But during a consultation, we really get into specifics of the person and do they have any risk factors that we can change and try to make those risks a little bit lower. So a little bit of a vague answer for a big question, but very important, and a really important part of the process leading up to surgery is really, with the specific surgery in mind, understanding what are the risks of implants, what are the risks of lift, what are the risks of a tummy tuck, and talking with your surgeon about what can you do to make those risks as low as possible.
I think that's great. And having like a community, again, you kind of get an idea of, yes, there are women in there who have like, I've had this little bit of a complication, but complication can also be a tiny little stitch spitting, you know, or things like that. So,
and most often it is, but most of the things that we see are small little things, a little spitting stitch, like you said, a little area we have to put some Neosporin on, a little antibiotic. So small things like that. The really scary, bad things, thankfully, are very rare.
Yeah, agreed. Thank you. Okay. I'm 17 days post-op, and I feel like the tightness is back as bad as it was a few days post-op. Could my hormones or my period cause this? And when does the tightness go away? I'm gonna guess this was a breast augmentation. So had some tightness the first few days, haven't. Now I'm 17 days post-op and I feel like it's back. What could cause that?
Yeah, so could hormones be playing a role? Absolutely, that absolutely can be playing a role. The other thing that comes to mind when I hear about that time frame of about 17 days in the 2 to 3 weeks is around that time frame, people are starting to feel better, starting to feel like a little more like themselves, moving a little bit more. And with more movement, which is good, also can come a little bit more swelling. So it wouldn't be that unusual if around that time frame somebody starts to notice more swelling. Now, if there ever was a significant change, especially if it's in one side and not both, that'd be something we'd want to know about. But that's really unlikely. But a little bit of increase in pain and tightness and swelling in that 2 to 3 week period is not a cause for concern.
I was going to say too, that's often when women in the community start talking about sleeping on their side again, or even trying to sleep. And I'm like, that causes swelling and stiffness when you wake up when you're trying to sleep in a different way. But
yeah, sure.
That's probably the biggest complaint, and you probably hear it as well, is like sleeping afterwards when you can't get comfortable. So I love all the pillows and the triangle pillows, and the neck pillow is gold for trying to sleep on your back afterwards. But I promise it all goes back to normal. Okay, I love this question. Do you use anything like Exparel, the long-lasting numbing medication we usually use for tummy tucks? Do we use anything like that for breast augmentation? And why not? Make it pain-free.
Sure, yeah. So I don't, because I don't think that for most people it's generally needed because of the rapid recovery that we do. So the main thing that causes pain, in my opinion, after getting implants is the tightness from the muscle. And the rapid recovery is all aimed at helping the muscle relax. It's stretching exercises and a muscle relaxant and massage. All those things help the muscle relax. It's like the complete opposite for how they used to do things decades ago, where they'd wrap people up with an ACE wrap and tell them to just go like this for, and then you get really stiff and it's a lot more painful. So I think with that, many people go through the surgery with a really straightforward recovery, minimal pain medicine, if at all. Now, the times when Exparel is maybe more important, there are some people that can't take narcotic pain medicine. Then that's a reasonable thing to talk about. If somebody can't, for certain reasons, take it at all, maybe worth considering. But again, I don't think that most people would really need it, or that it would make a huge difference.
Yeah. Do you see this question? Can you see him as well? Because this is, I do see, do I massage? Do I not massage? And it's an easy one because, like, way back in the day, we used to massage. I had to massage for my first breast augmentation, as you so eloquently said, decades ago. We did things like that, but now we don't. But I always am like, do what your surgeon recommends. But is massage, what do you say about massage? Is it helpful?
So the reason you're going to hear different things is because nobody truly knows what helps with drop and fluff and things. I personally feel that massaging the muscle helps with pain, just like if you had a stiff back or calf muscle, massaging it helps. So I think massaging the pec muscle, the chest muscle after getting implants may help with pain. Do I think it's going to change the drop and fluff process? Probably not. I mean, there's no research that shows that makes a big difference. I will, though, sometimes tell people whose implants are a little bit slower to drop, why don't you massage them towards your toes? Maybe that just makes me feel better that you're suggesting something that may help. Again, there's no research that shows that it makes a difference. But I do think a little bit of chest muscle massage afterwards probably helps with pain and swelling. So
you don't mean, though, like actually manipulating the implant, like pressing down on it the way, like, and manipulating it. You just mean a kind of gentle muscle massage, correct? Yeah, correct. I generally don't tell my patients to, especially in those first, weeks, to really massage their implant. I think that once you're out from surgery, massaging the implants is a good thing, if nothing less than just allowing you to be aware if something changes. Like, I think that if you're regularly massaging your implants, if you start to notice that one size feels a little bit different, you're going to notice it because you're used to feeling it, and then we can talk about it sooner. So I like that side of things, but I don't know that it makes a difference in preventing capsular contracture or really changing the final outcome. Good. I would, say, please ask your surgeon, and then ask for a demonstration like that or whatever too. So you can, when you go home, you're like, did I remember this right? Am I doing it wrong? I work here, and that is still like the hardest thing for me. So ask many questions, ladies. Okay, what am I talking about? 2. I asked that one. Okay, good. I think I got all. Oh, no, here's another one. I have under the muscle implants and recently started lifting heavy weights. How restricted am I in regards to doing chest work since I'm under instead of over? We hear a version of this question 17 times a day in Bustmob. What's the deal with working out and over versus under?
Yeah, so for the first 6 weeks, I tell my patients no chest exercise because we want everything to kind of settle the way it's going to be and not have the implants moved around at all. But after 6 weeks, I tell my patients they can do any sort of chest exercise. It's fine. Now, in the beginning, it's going to feel a little bit weird. It's going to take some time to get back into it. But I think it's fine to do any sort of chest exercise. The only thing that I do think could affect the implant pocket over time would be very frequent repetitive chest exercise, which in my mind is mostly like a competitive bodybuilder who's really focusing on their chest muscles. I've had patients that are doing competitions, more probably swimsuit competitions, that say, well, I'm not really building my pec very much, and I think that's fine. But if you know that you're doing hours worth of chest exercise every day, that probably is going to push them out to the side and could affect pocket placement. So that I would avoid if they're under the muscle. But otherwise, I think it's fine to do anything.
For those ladies, would you recommend over then?
Yeah, that would be one of the very uncommon situations where I would tell somebody they really cannot have them under the muscle. If they are going to be doing that, we really should put them over the muscle.
But we're talking about extreme.
Correct.
Everyday heavy lifting.
Focus.
So yeah, I think most of us like to think that we are regular worker outers, but it's it's fine for most people. Okay, that was a great question. Someone just asked a question too that I don't know the answer to. I think I do. She said, my breasts, I have naturally large breasts and they're heavy. Would removing the tissue, I'm paraphrasing, and putting an implant in actually make them feel lighter? I don't know. Implants feel heavy sometimes.
Yeah, that's a great question. So the density of a silicone implant is very similar to the density of breast tissue. So for an equal volume, the weight's about the same. So we think about, let's say, like 300 grams of breast tissue is about a 300 cc implant. So the weight is about the same. The thing that causes most of a change after a breast reduction or a lift, or a lot of the change, not only removing some tissue, but also having them repositioned, especially because if they sit low, for the bra to be able to pull them up, it puts a lot of tension on the shoulders and things. So it may be that just repositioning them alone with or without implants is going to help with back pain and things like that. But the weight of an implant is going to be similar to breast tissue.
Okay, that's good. People are always asking too, like, how should I start subtracting the weight of my implants when I hop on the scale? I do. But also, like, how much do they weigh? So it seems like a loose, what does a 400 cc silicone implant weigh? Is that like a pound? I'm sitting here trying to.
Yeah, it's going to be about 400 grams. It's not a lot. It's, I have to put it into Google.
I know. Maybe I'll do a little calculator later. Then we can all subtract it when we get on the scale. Okay, I've got some straightforward implant questions. Which also, again, if you are curious about these things, get in the Bustmob community and ask them in there as well. You'll get hundreds of responses from women who actually either have this size or have gone through that. It's literally what most women are talking about in there. So why does the same CC amount and profile types look different on people with similar frames? I mean, like, you can look at Goalfinder and see this. So, you can put in the same parameters, but they look kind of different on everybody's frame. Why is that?
Yeah, that's a great question. And it can be a cause for confusion when, let's say you're considering 400 cc implant and you look at a picture of somebody as 400 cc's and they look totally different than somebody else. It happens for a few reasons. A lot of it has to do with the breast width or the base width or the BWD. Is that even though somebody's frame in a picture may look the same or their stats may be the same, you truly don't know what their base width is unless it's been measured. I can't tell just based on a photo. I really have to measure it to know what it is. And somebody with a narrower width is going to look like they have a larger implant than that same size implant than somebody with a wider chest. So when I have a patient that has a wider base width, I'll tell them, don't be afraid if you start seeing larger sizes and we start talking about larger sizes, because that may be what you need to get the same look as somebody with a narrow width with a 350cc implant. So a lot of it has to do with that. There's other differences as far as what we call the breast footprint and where the breast actually sits on the chest. Does it naturally sit higher or lower? So that can play a role too, but I think base width is going to be the biggest thing that causes the same size implant to look different on different people.
Gosh, that's such a good point. And then now that can lead me into that first question that was asked. She was like, I'm very narrow. Does that mean I have to get ultra high profile implants to be able to fit in there? Is that what people recommend when we start talking about profiles?
Yeah, it may be. That's a thoughtful question, because what I tell people is the main thing that's going to have us choose a certain profile over another is the width. Because if you try to put an implant that is wider than the space that's created for the implant, it just won't fit. During surgery, if you tried, it would be bulging out through the incision. You wouldn't be able to close it. You can't fit an implant that's a lot wider than the space. There's just no room for it. So you have to be thoughtful when choosing an implant to choose one that's not too wide. When people will ask, is there a certain maximum size that I can be? And I tell people that for the most part, really one of the few things that may limit size in some people is width. If they have a very narrow width, it may be that a 500cc implant is just too wide. Not that it's too big in volume, but it might just be too wide. So one way to help with that is going up in profile, because as you go higher in profile, the implants get narrower. The ultra high profile have the narrowest width, the low profile have the widest width. So there are some people that, let's say they want a little bit of a larger implant, but they're very narrow. We may need to go to an ultra high profile just so that it can fit.
So well said. And for the opposite, for the ladies with the wider rib cage, I remember asking Dr. Pyle, oh, I should get high profiles, right? I want a little bit more fullness here. And he was like, no, you need to fill up the space here. It would look really weird if you didn't find an implant that balanced out. Like I had never thought about it like that. It was so helpful.
Yeah.
Did you see the question before this about chest wall measurement versus BWD? Can you see that?
I think I missed it.
Okay, let me see if I can scroll down back here. I'm so nervous.
Oh, I see it. Is BWD different?
Yep.
than
Can I
chest wall
have
measurement?
a wide BWD but a narrow chest wall? I don't know.
I'm not sure. I don't separately do another chest wall measurement. I'm not sure exactly what that would refer to. The measurements that are most important in terms of choosing an implant are going to be BWD, the width of each specific breast. Maybe chest wall refers to the whole width of the chest. If that is the case, the only difference there would be some people's breasts are naturally spaced wider apart. So, they could be spaced very close together and still have a wider chest. But for the most part, BWD is going to be what translates into implant size and width and things.
Got it. I like catching you on the fly with some of these questions.
Yeah,
These are good. I
Yeah,
actually
really
want to, this isn't a fun question, but actually I hear lots of different things about people either having surgery out of the country and coming back into the country and trying to find somebody to treat them, or even traveling for surgery. And so I like this question. If you have an incision open and need help, I've heard that a local doctor will not touch you. There are things like that where you assume care, and that's nerve-wracking. I'm worried about being 5 hours away. Is that an issue? Like, have you ever had patients who you did not do their original surgery, but you comfortably help them post-op? What should patients do?
Yeah, so we have a lot of patients that travel from out of state and even airplane right away. So that's an important thing to think about, is what happens if something happens. So a lot of our patients also live in that 4 to 5 hour range. So it's important to know. So one, as far as, have I helped people that have had surgery elsewhere? And as a plastic surgeon, yes, I have, in the hospital in certain situations, been involved to help and things like that. But with regards to, our patients being further away and things coming up, I like to reassure people that if something is going to come up, it almost always is something that we can manage over the phone, over email, with you sending pictures, us talking through it. It pretty rarely is something that I would say you need to go see a doctor near you, or you need to drive 5 hours to come here. Because the things that come up when we were talking about complications, most often, if anything, would be a little area that we have to put some Neosporin on, cover with a Band-Aid, or an area that looks a little red, I'm going to prescribe some antibiotics. And we're just staying in constant communication with pictures and phone calls and things like that. So that would be how it's managed most. Now, if there truly was something, if there was an emergency, then I would tell the person you have to go to the nearest hospital. So if someone's having an emergency, they can't travel, and then they do have to see somebody else. Now, if there is something that comes up that really is going to require the management of a plastic surgeon, that can get a little more complicated because what do you do if you're 5 hours away? Now, one option is traveling and dealing with that, but that can be difficult. Those situations are incredibly, incredibly rare. And in those cases, I think the plastic surgeon should work with the local people in that community to try to find the best place for them to be taken care of.
Yeah, well said. Thank you. I do have lots of people ask about that. And it is something they know it's uncommon, but just covering their bases, you want to be able to, you know, have someplace safe you can go if something does happen, but it is rare. There's a question about numbness. I'm going to guess it's a breast augmentation, but 3 weeks post-op and I have no sensation in one. How long does numbness usually last in general?
Yeah, so if we're just talking about breast augmentation, numbness in the nipple, permanent loss of sensation in the nipple after breast augmentation is going to be incredibly rare. Some people will have some numbness in the lower part of the breast, and it can take time to get back to normal, but it almost always does go back to normal. It would also be very rare for there to be numbness in the lower part of the breast after breast augmentation. The lift is a little bit different because you make an incision around the nipple, and anytime you make any additional incisions anywhere in the body, there's a higher chance of numbness. Now, after a lift, still, most people end up with normal sensation after a lift because the incision around the nipple only goes through the top layer of skin, not cutting through any major nerves or anything like that. So if there is some numbness that's there a few weeks after, it usually comes back. You have to remember that nerves are very slow to regenerate and recover. It can take a year, even sometimes a little more, for sensation to come back. But with a lift, there always is a chance of having some permanent numbness, but that's an uncommon thing after a lift.
Got it. That makes sense. Okay. Don't worry, girl. I'm just going to get to your breastfeeding question because this was me and I love it. I had my augmentation 5 years ago. Now I'm ready to start my family, get pregnant. How, you know, I want to breastfeed. How could that change my breasts since I have implants? And again, I did this with 2 kids. So
yeah, so it's not going to limit somebody's ability to otherwise could breastfeed because the implant is under the breast tissue, it's under the muscle, under the breast tissue. Even if it's over the muscle, it's still under the breast tissue. So it's not going to decrease somebody's ability to breastfeed. As far as how the breast changes overall through the course of pregnancy and breastfeeding, that's one of those things that's going to be a little bit different for everyone because there will be changes, and then kind of have to see how things are when breastfeeding is done.
Yeah, I've answered that question 1,000 times for women. And I'm like, you know, if you were super flat before, like me, you didn't really have a lot of breast tissue. I didn't have many changes after both pregnancies or breastfeeding. There wasn't a lot of tissue to go anywhere. But then I had girlfriends who had very large kind of, you know, a breast where they might have needed a lift anyway. Then they breastfeed twice and theirs is a lot lower. I think just like your question earlier about how long is it going to last, skin elasticity and lots of things, weight gains and losses, but honestly, mine looked a little bit smaller and I ended up exchanging my implants to go bigger again, and then they looked identical again. So it's like I lost 30 cc's or something during breastfeeding, and that was it. I was very glad I did not wait till afterwards for me. I can answer this one. Is there a noticeable difference between 5 to 10 cc's of implants? Absolutely not. No. Like, there's barely a difference between 50 to 75 cc.
Yeah. I always tell people, like, picture, let's say you're talking about an implant in the 400 to 500 cc range. Picture like a half a liter bottle of soda or something, and now you're pouring 2 tablespoons in. You really won't even be able to tell a difference. So that's really the difference between 1 or 2 implant sizes. You really have to change by 100 to 150 to have noticeable changes.
Yeah. Okay, this is a good one too. I like this because I don't ever know how to answer people's questions. I'm not a nervous Nelly. But we have some nervous patients, and I understand that. And they're like, it's the night before my surgery, you know, I've been leading up to this. I'm trying not to drink, maybe. I'm, you know, all my other vices, I'm not doing those. How, like, can they take Xanax? Like, what if you're super nervous the night before surgery? What do you tell patients?
Yeah, so the first thing I would want to know for one of my patients is what's making them the most nervous. I mean, surgery in general is scary. Anesthesia is scary. Totally understand. But if there's something specific that's making the person nervous, then maybe we can help with that. Just reassuring people, this is what we do every day, all day. For our patients, it's, you know, once in a life thing, but this is all we do every day, and people do really well. And you know, person out there that is having surgery tomorrow is going to do really well, because again, this is what we do, and people do great. So that doesn't mean that you're going to be less nervous. As far as taking something the night before, that I do like to leave up to the anesthesia providers, because they're going to give similar medications, you know, when you get here and get your IV, things like that, and they have to be comfortable with what you have in your system, as to not make sure you didn't get too much or things like that. There certainly have been situations where we have had people take things before, but that's a conversation to have with anesthesia for sure. Yeah. The main thing I tell people is, if you're so anxious that you might not get here, then we need to talk about you having something so you can get here. But for the most part, if you're okay enough that you can get here, I know you're not going to get a lot of sleep before, then generally we kind of keep things out of their system, and we'll give something to them when they get here. Yeah.
Excited nervous is great and normal. Terrified nervous.
Correct. Yeah.
Probably call your surgeon. But also, if you're excited nervous and you're just nervous, just get in Bustmob too. Like, there are so many women who are like T-5 hours, T-3 hours. And then you have a ton of women who are like, you've got this, you've got this, you've got this. It sounds weird, but it is reassuring that you're like, I'm not alone.
Yeah.
Wow, there's hundreds and hundreds and hundreds of other women who have done this too. So it can be very helpful.
And one thing that I think is amazing, and I love when I see, is when people come on the day of surgery and they've met the person who's having surgery right after them on Bustmob. That's so cool.
It is cool. Yeah. I've seen a couple like that in Bustmob recently in your office. Like, I was just there. I saw you in the waiting room. I think that's really neat. Even the Surgery Sisters group, Bustmob also has a group that you can specifically also join once you're in the community, where you're connected by surgery month. And then you're kind of at the same stage of emotional, you know, excitement as the person. So that's a really neat option too. Okay, I think this is what we were talking about earlier. Wide BWD, but a naturally close breast. Is a more narrow implant needed, or would regular protocol for choosing implants apply?
Yeah, I would say still regular, the same concept, which is you want to fill the space of the breast with an implant. You don't want to have a narrow implant floating around in a wider breast. So you still want to fill the space. Does that mean they're going to look close together? Yes, but that's your natural anatomy. Just like if somebody's breasts are naturally far apart, they're going to still be a little further apart with implants. You can't really change that.
Okay, continuing with implant questions that I actually don't know the answer to. Have you ever dealt with soft pectoral muscle tissue? I've never even heard of that. My doctor said mine were so soft he could separate the pocket with his fingers, gross, where he typically cuts. I'm worried about bottoming out in the future because of this. Is that a thing?
Yeah, so as surgeons, we see so much variation in anatomy, especially in the chest, in the pec muscles. I mean, there are some people's muscles are really tight. There's some people's muscles are looser. We notice things during surgery all the time. If you're doing the same thing again every day, you just notice these subtle changes. Oh, this person's feels different with liposuction. They have more dense fat, more loose fat, these little things. So it wouldn't surprise me that a surgeon would feel that way, just because they are very aware of kind of what they see most of the time. Does that mean that you're at more risk for bottoming out? Not necessarily. Bottoming out can happen for a handful of reasons. It's not just the muscle. There's a lot of other tissues involved. So I wouldn't worry. I mean, I think that if you were to notice something, then it's something to talk to your plastic surgeon about. But just because that's an observation he had, again, it's just a subtle thing that he noticed as a surgeon. It doesn't mean that you're more prone to something.
That makes a lot of sense. Sticking with muscle talk, chest muscles, if this person has under the muscle implants and they're interested in potentially moving to over the muscle implants or removing them, how does the pectoral muscle heal? And is there a different recovery for that?
Yeah, so when you put implants in under the muscle, you have to release a little bit of the muscle in the middle part where it attaches to the sternum to allow the implants to settle. Once that's released, the muscle kind of recoils up a little bit, and it forever is that way. It just heals in the position it's in. If you take out the implant, nothing really changes with the muscle. The muscle is going to relax and everything's going to contract and kind of scar down, and things will kind of go back to the way they would be, but nothing even really needs to heal with the muscle if they're being taken out. Now the capsule, the space where the implant was, usually over time just kind of scars down and goes back to what it would be. But even in people that don't have implants, the muscle is not stuck to the rib cage. It's not stuck down there like some other tissues are. There's actually a very loose layer for the muscle to glide on top of the rib cage, which is needed for your arm to move.
When I had mine switched from under to over, it was like the easiest surgery. I remember waking up and being like, it's so funny what a difference it was. It was very easy recovery for me. Let's talk about implant types, since there are a couple questions getting dropped in here about what's the, I can't remember. What's the longest lasting implant? True or false is gummy bears. Do they last longer than traditional silicone or saline? And then what's the difference in softness for the different silicone because there are many different types and brands of silicone in implants. What's the best? What's the worst? What do you think?
Yeah, so as far as how long they last, so the most recent version of implants we call 5th generation. It's like the iPhone 13.
Yeah.
What they're up to. That's the most recent version of implants. And that generation of implants hasn't been around for 30 years. So we don't necessarily know for sure how long are those going to last. Now, older implants, plastic surgeons used to say every 10 years you have to get new implants. We don't say that anymore. Unless somebody's having a problem, they don't need to just be changed out unless there's a reason to or a desire to. Generally say that these modern implants will last 20 to 30 years or more. They may last far longer than that. As far as softness, in my opinion, the 5th generation, the gummy bear implants are the best balance between giving shape and softness that have ever existed. The problem is that if you have an implant that's really, really soft, it's not going to have shape. And if you have an implant that has a ton of shape, it's going to be like rock hard. So what they've been able to do is find a way to make an implant that is very soft so that it feels natural like breast tissue, but also has really good shape. And I think these modern version of implants are the best of that. And in my opinion, better than saline implants, which are just water, and you can't do anything to water to make it act differently than water. It just is what it is.
No, that well said. Gives me confidence in my decisions, what I got as well. Okay, I've recently heard that some surgeons try out implant sizes during surgery and then go with what fits best. But isn't that bringing in bacteria that can lead to capsular contracture? Is this common practice? I love this question. This person knows what they're talking about.
Yeah, they do. Is that common practice? Yes, it is. So the idea of using sizers, we call them sizers, sizers during breast implant surgery is very common. Most plastic surgeons use it in many of their surgeries, not necessarily all, but many. But the idea is that for various reasons, you may want to check the size that the person chose, or check for symmetry. And there's different types of sizers. We here use one that actually kind of looks like a saline implant with a tube coming out, and we fill it with air. And we check that way. Some people use they're called gel sizers, so they're silicone sizers. Now, as far as how it relates to bacteria, regardless of the sizer used, this is a sterilized sizer that has gone through the same sterilization process as any surgical instrument. So it's not bringing any extra bacteria in or anything like that, because it's gone through the autoclave, the sterilizer, and it is completely safe. This is not, just sort of the same set of sizers that's just being used over and over.
Awesome. That makes a lot of sense. I saw one more. Sometimes we get questions about, hey, if I get implants now and did 30 years, I find out I have breast cancer, what will happen? Will they remove my implants? So there was a question similar to like, if I get under the muscle implants and years from now I need a mastectomy, will they remove my implant as well? I have no idea.
Yeah, great question. So it really depends. It depends on what treatment they need to do. Will they absolutely need to? Not necessarily. I no longer do breast reconstruction, but there are plastic surgeons that are doing breast reconstruction and breast surgeons where they are leaving the implant in the capsule, but there's a lot involved and it really depends on the unique circumstance. So not necessarily. The important thing to know is that by getting implants, somebody is not losing their ability to get breast reconstruction in the future.
And mammograms, now that I'm over 40, with implants was a concern of mine. And it was so easy. I actually think my mammograms after implants were better than what I've heard women, because they have to be so gentle, with them. So it was actually easier. So I still recommend people get those. Let's talk about scars really quickly. People often ask, and I swear you and I might have talked about this before, but, are there lasers or treatments that if someone still isn't happy with their scar, you recommend? And at what point in their healing should they consider that? Because too early, it seems like, it still might get better until a year.
Yeah, so there are lasers that have been well studied to help with scars. A lot of research in the burn world and helping with scars. You generally would want to wait at least a year because a scar is still going to improve in that first year. But after a year, there are lasers that can help with scars. Now, most of the time, that's not the direction that I go with my patients, and it really just depends on what's the problem with the scar. Because what may be a far easier solution than lasers is doing some sort of small scar revision, which usually can be done with just numbing medicine, really no recovery, and can just be a one-time thing and it's done. Versus lasers, generally you need multiple rounds, and if there's a much more direct way to deal with it, that may be better.
Yeah, I think we did talk about it before. The downside is you're starting over with the scar again. But the upside to me is I wouldn't want to waste a ton of money and time on laser treatments and it still not get me to where I wanted to be. But I don't think most people with an augmentation or a lift need it.
No, that would be very uncommon.
Yeah.
And, a good question that people may ask is, well, if you cut out the scar, then is it going to just happen again? And the answer is that your conditions are very different. Scars that are under a lot of tension, like things may be after a tummy tuck or a lift, may heal not as well as we want them to. But when you have the opportunity to go back and cut that scar out and do it again, you're not necessarily under the same circumstances, and it may have a better chance to heal differently.
Absolutely. Okay, last question. I will leave unless anybody has any other questions. That was a lot. I'm sorry. I literally had to bring in a water to take sips. You're being a champ. I'm not even exactly sure what this question means, but I like talking about bra line lipo, especially when we talk about breast lifts, breast augmentation. We got an area under here or here that can be enhanced by doing liposuction at the same time to make your breasts look a little bit more the way you wanted to. So the question specifically was, how do you handle significant bra line fat, maybe needing even more than liposuction? Like we often do have women as well who almost have breast tissue out here to the side. When can you do bra line lipo versus you need tissue removal? Is it included? Talk to me about that.
Yeah, so bra line liposuction, which is like the area you were showing there, kind of under the arm, that can certainly help, especially when being done with a lift. And the reason being done with the lift helps is because with the lift, the breast is being kind of pulled up towards the middle. You can do that with your hand, and you see that the skin gets a little tighter on the side. So combining that movement with some liposuction can really help with that area. Now, a lot of people, like you said, have extra skin there also, even with doing that. And it's really important to know that if there's extra skin there before, there's generally going to be extra skin there afterwards. Bra line liposuction does not remove extra skin that goes around to the back. That's an area that a lot of people are bothered by, and an area that I talk a lot about during consults when people show me. But it's important to know that you can't really remove you can't really get rid of extra skin without removing the skin. Now, removing that extra skin can be done. It's called a bra line back lift. Most people don't want to do it because the trade-off is a big scar that goes across the back. So generally with just liposuction and a lift, you get some improvement, and that's where most people are happy with that. And if that is a significant issue, then we can talk about cutting out the skin there.
That's awesome. I'm always like, people just ask during your consultation. Like, you don't know, you guys will definitely tell us no if we're not candidates for it, or you don't think it's something that would be worth, you know, the outcome wouldn't be worth, you know, doing it. But yeah, just ask, because you never know. I ended up doing cool sculpting to these little areas, and it was so great. It really made a big difference. But I probably would have had liposuction had I been combining it with something else. So thank you so much for, again, sharing all your time in your busy, crazy life with 3 little boys and a big, busy practice. Any last minute thoughts from over there in St. Louis for the Bustmob community?
No, just you guys are great. I'm so honored to get to be a part of this with all of you, and just keep supporting each other, keep asking great questions, and let us know if we can do anything to help.
Well, thank you for being so transparent. It's very helpful, and hopefully we'll see you soon.
Yep. See you soon.
Thanks, Dr. Fredman.
Thank you.